Hi everyone, Vanessa here, your favorite registered nurse. Happy Sunday. So today I wanted to talk about HPV because despite there being a vaccination for HPV, there's still a lot of questions, so you're not alone. I'm going to talk about the what, where, when, who, why, and how about it. So stay tuned. So let's start with the what. It's important to know that some types of HPV can cause the warts on your hands and your feet, known as plantar warts. We won't talk about those types of HPV infections today. Today, we will focus on HPV as a sexually transmitted infection. So I've compiled 3 main things you need to know about HPV, starting off at number 1. HPV, or human papillomavirus, is a sexually transmitted infection that affects humans. Number 2, there are over 200 different types of HPV, and they are named by their numbers. They're further classified as low risk and high risk types. High risk types are often associated with cancer. Although they're associated with cancer, the development of cancer because of HPV is considered a rare occurrence. And number 3, it is estimated that 80% of sexually active males and females have been exposed to HPV in their lifetime. So what about the where? Well, HPV affects your anal genital area, meaning your vulva, vagina, cervix, penis, or anus, as well as your throat. There are 40 different types of HPV that cause genital warts. HPV 6 and 11 make up 90% of cases. Genital warts are generally considered low risk for cancer, but should still be checked out by your family practitioner. It is important to note that despite the fact that you may not see the HPV infection with regards to genital warts, it doesn't mean that they're not there. They could be in the vaginal wall or in your rectum. So if you have recently had unprotected sex or think that you might have an HPV infection, it is important to go to your family physician for a visual inspection. What about the HPVs that are not seen? Well, in fact, there's 15 different HPV types that are associated with cancer and considered high risk. HPV 16 and 18 being of the highest risk. HPV 16 and 18 have been known to play a role in anal cancer, penile cancer, and throat cancer. Unfortunately, there is no screening tests available to men at this time, nor screening tests for those types of cancers with regards to HPV. HPV has also been known to cause 99% of cervical cancers, with HPV 16 and 18 being the main factors within that. It is important to note that precancerous and cancerous lesions within the cervix do not have any signs or symptoms, so it is important to see your family doctor for regular screening as per local guidelines. For example, in Ontario, if you have had previous normal PAPs, and you have had the same partner, then you would have screening every 3 years for a PAP. If you have had previous abnormal PAPs, or you have had a different partner within the years, then you would have screening more frequently. It is important to talk to your family healthcare provider on what screening is appropriate for you. Now we move on to the who is affected. Well, it is people who are sexually active in general. So that would be men who have sex with women, men who have sex with men, and women who have sex with women at any age. What about the when? HPV is spread through sexual contact. It is important to note that intercourse is actually not required to spread HPV. It can also be passed on between fingers and toys. So, how do you prevent this from happening, and what is the treatment? Well, it is important to note that your body can clear HPV without any treatment, generally within 12 months. But to protect yourself, it is important to wear condoms during sexual activity. That includes vaginal sex, anal sex, and oral sex. You should be wearing a condom. It is important to also note that condoms only protect the skin that they're covering. So if there is skin that is coming in contact with you, not covered by a condom, that has HPV infection, then you are at risk of acquiring the infection. It is also important to note that if you do develop an HPV infection, it doesn't mean that your partner was unfaithful or you acquired HPV from the last person you had sexual contact with. Because HPV is a virus, it can is latent, meaning you don't have any signs or symptoms despite the fact that you have HPV for days, weeks, or even years. So if you develop warts, it doesn't mean that you have just gotten HPV. It could have been any of the previous partners that you've had. Another way to protect yourself from HPV is the vaccination. So there have been a couple of vaccinations that have been created by scientists, and the most recent one is Gardasil 9, offering the most protection for you of HPV. And as you may have noticed, when you're looking at the specific vaccination, it tells you what strains of HPV it is protecting against. So the initial vaccinations that were created often, I believe, covered 4 types of the HPV infection. So it was covering 16, 18, 6, and 11. So as you might recall, the 6 and 11 are the genital warts, and then the 16 and the 18 are the ones that are most prevalent in high-risk HPV infections and causing cancer. So that was really great. And since they've come up with Gardasil 9, which is protecting you from even more cancers. So you should check that out and see if it applies to you. So moving on to treatment. So it is important to note that HPV cannot be cured. So that means your warts cannot be cured and your lesions cannot be cured. Your precancerous or your cancerous lesions can't be cured, but they can certainly be treated. So with regards to warts, you can either go to your family physician and have cryotherapy treatments, which means that they freeze off the warts in their office. Often this happens over multiple treatments, so it doesn't all happen all at once, just to be prepared. Or the physician can prescribe an at-home ointment that you would take home and put on the warts. Again, just because the warts are treated during that time doesn't mean that you are rid of the virus entirely. It is possible that the warts can come back at another time. And then with regards to lesions, either they're precancerous or cancerous, that is why it is important to go for regular checkups for cervical screening, because it is possible to treat the precancerous lesions or the cancerous lesions by your family doctor, and you can talk about the different procedures with your family doctor that apply to you. As with many other cancers, it is important to note that early detection is really the biggest priority in making sure that you get it early and it doesn't affect your quality of life. So again, I can't emphasize the importance of getting screening, so I really urge you to do so and make sure you're up to date on your PAPs. And then as soon as any type of screening comes out for males, that you should definitely do that as well. So I just wanted to end off by saying that, as you know, HPV is very common, and if you have been affected by HPV, generally your body will clear the virus without any treatment within 12 months. It is also important to note that people with HPV should not be judged. It is a sexually transmitted infection and it can be treated, and people with HPV can certainly have fulfilling sex lives. Lastly, I just wanted to end off with the fact that if you do have HPV or suspect that you do have HPV, remember it's very important to seek treatment and make sure that you're monitored on a regular basis to ensure that there are no lesions that could be precancerous or cancerous, and ensure that you get treatment immediately, because as you know, it is always better to treat cancer at the earliest stage possible before it spreads or causes any issues for you. And that's all. Thank you so much for tuning in, and see you on Tuesday.